Hey everybody, Dr. Bob Vaughn, your local health and wellness expert, and I'm here with our lacrosse ball series. So we're going to be using two tools here. We're going to be using the lacrosse ball and the double lacrosse ball. These are great instruments to get to some of the smaller areas which we'll go through. Again, some basics when you're doing any type of mobility work. Healthy tissue does not hurt when you push on it. So if you roll over an area of your muscles and it hurts, that means it's unhealthy, and you need to spend some time breaking up some of that scar tissue so your stretches and your strengthening exercises are more effective afterwards. So again, healthy tissue does not hurt, unhealthy tissue does. So those areas you want to avoid because it hurts, those are the ones that actually need some of the love. So making sure you're doing that. Other things that'll make your mobility training more successful: staying hydrated. Your muscles are 70% water on average, so it's extremely important that you're drinking enough water to make this effective. So making sure you're staying hydrated, and after you mobilize, make sure you check out some of the stretch series that we do, because once you get the tissue loosened, it's extremely important to put the proper force on it to get it to lengthen back out so you can stay healthy and well here. So with that, let's get started. So we're going to start off with our levator trap stretch. So we're going to take the lacrosse ball, you're going to put it on the levator, which is that stress spot that most people store right at the top of the shoulder blades. It runs up to the neck here. And we're going to start up against the wall. If you're doing it against the wall and you don't feel anything, feel free to lay on the floor, get some more force in there, but I would recommend starting on the wall. So we're going to take that lacrosse ball, place it on that levator knot, and then you are going to lean into it, and you're just going to move back and forth, and we're going for about 30 seconds. And again, you're going to find some of those tender spots, and when you do, that's where you want to start rolling back and forth, up and down, side to side, and getting that loosened up. Now, areas you want to avoid is obviously you don't want to roll over bones on there, so you want to stay off your shoulder blade or your scapula, off of the neck and the spine, which is why you want to be very specific with that. And we're going to hold that for about 30 seconds as we're rolling through. Now, you can go upwards of 90 seconds, so if you're doing this and you don't feel quite stretched out or loosened up yet, I encourage you to hit the pause button and catch up with us afterwards. But we're going to switch over to the other side here. So just take that again, and you're going to reach over, put that on that levator spot. And again, we're going to roll back and forth, up and down over those tender areas. And again, if you're not getting enough pressure up on the wall, you can go ahead and lay on the floor. That will take some of the pressure off. And again, we're going to spend at least 30 seconds in upwards of that 90-second range. You don't want to go much more than 90 seconds on a spot, just because the tissue can bruise, and you do want to give it some time to heal in between as we're breaking up that tissue. So you can go ahead and relax there. And if you need to, feel free to hit that pause button to spend a little extra time on that. And that is how we use the lacrosse ball on the levator muscle. Next thing we're going to be working on those mid-trap rhomboid areas. So all those muscles in between your shoulder blades and along through there. So if you spend any time on a desk or computer, you're all hunched over, these muscles need some love. So we're going to start with the double lacrosse ball. It's very fancy. It's two of them taped together with some rock tape. So we want to make sure we're getting this loosened up. So what you're going to do, starting on the wall, you're going to place it in 3 spots. First one's going to be a little higher up. So we're going to place it between the shoulder blades. The nice part about the double lacrosse ball is when it's between the shoulder blades is that it doesn't run on your spine and it doesn't go on your shoulder blade. So it perfectly fits on those paraspinal muscles, and you can get deeper than you can with like a foam roller. So you're going to spend about 30 seconds on the higher portions. You're going to need to break your mid back into about 3 sections in order to get these loosened up. We're going to spend about 30 seconds on each spot, kind of up and down, up on the toes, squatting, get a little bit of workout there. Once that area is loosened up, we're just going to let that ball slide down a little bit. You might need to reach back there. Eventually, you'll get really good at it, and you can just slide it up and down on your own. And then again, we're going to hit that mid-back area for about 30 seconds. As you get lower in the spine, typically you're going to notice it's going to be more tender, and you're going to have spots that are more tender depending on your height, what you're doing for work, ergonomic-wise, things like that. This is also really good to help open up that chest if you're having trouble like with your squat depth or leaning forward on your squats. This is really going to help loosen that up as we go from there. And then the last portion we're going to do here is going to be that TL region, or just the very low part of that mid back, where the lower back comes in. And then we're going to just spend some time through here. And you really want to think about extending back over that lacrosse ball. Now, if you do this and you don't feel anything, go ahead and lay on the floor. It's going to have quite a bit more pressure because gravity is going to be in control of that, loosening that all the way up. But if you're not feeling it up against the wall, you can also lay down and do this on the floor. Like I said, if you feel like you need some more time on this, feel free to hit the old pause button and catch up with us on the next stretch here. So you can go ahead and relax there. And that is how we use a double lacrosse ball to work the mid-traps and the rhomboids. Next thing we're going to do is we're going to use this lacrosse ball to work our glute med and piriformis, which is basically the whole hip area here that people talk about. You can either do this up against the wall or on the floor. I recommend starting on the wall because it's going to give you more control. And what you're going to do is you're going to start by taking this lacrosse ball and you're going to put it right basically in the center of your butt cheek. You're going to lean kind of sideways into the wall, and then you're just going to roll back and forth until you find some tender spots. And I did some squats yesterday, so I found one here. So we're just going to go back and forth, kind of side to side, up and down. You can even rotate the leg in and out, or the hip in and out a little bit. Just anything you can do to work that tissue over that lacrosse ball. Again, we're going to do that for about 30 seconds. When you find a tender area, that's your body telling you that it is an area that is unhealthy right now, because when you push on healthy tissue, it does not hurt. So you want to make sure you're keeping that nice and loosened up. We've got about 10 seconds left on this side, and we're going to switch over. So again, if you feel like you need more of that 90 seconds, hit the pause button, do another minute worth or so, and then push play and catch up with us here. So we're going to switch over to the other side. Again, when you're placing this, you want to take it, put it right in the center of that butt cheek area to start off with, up against the wall, and then you're just going to lean into that, have that leg out there. This way you're getting more of a lean as opposed to holding a squat as you're doing it, so a little bit easier there. You can even work your way kind of up towards the belt to get into those higher glute med piriformis areas there as well. So again, about 30 seconds. As you find those tender spots, you really want to make sure you loosen them up. And again, key part of this, like we talked about earlier, is making sure you stay hydrated and making sure you're stretching and taking the muscles through a full range of motion afterwards. Because if you do this, it will help some, but if you do this and then do a full range squat or some stretching afterward, it's going to be much, much more beneficial for all the things combined. So you can go ahead and relax there. Again, if you need a little more time, hit the pause button, spend another minute on there, and feel free to catch up. But that is how you use a lacrosse ball on the glute med and piriformis. Is we're going to be working on the pec muscle here, which is a really tight one. We showed a stretch for that earlier, and we'll do that up against the door frame. So what you're going to do is you're going to take your lacrosse ball, you're going to place it below the collarbone and in front of the shoulder joint, so right in through here. Pec is a triangular shaped muscle right in through here. Typically, most of the issues are going to be right in this area on that lateral side or right underneath the collarbone. So we're going to come up to the door frame. The door frame is nice because it has these grooves in it, which will keep your lacrosse ball only moving up and down instead of side to side. So you're going to take it in the chest here, lean into it, kind of turn away a little bit, and then it's going to roll up and down until you find some of those tender spots. We're going to work on that for about 30 seconds or so at a time. If you need more time, again, hit that pause button, work it out. Don't want to spend much more than about 90 seconds on a spot just to start off, because we do want to take some time to get that loosened up. This is one, if you spend a lot of time on a desk, this will typically get very tight on you. Most things we do are in front of us. Very rarely do we reach backwards to do anything. So this is going to help loosen those muscles up quite a bit more and make that doorway stretch much more effective, as we talked about. So we're going to go ahead and switch over to the other side. And again, go here. Now, if you're doing this and you don't feel enough pressure, you can do this laying on the ground. If you're doing it laying on the ground, you want to put the arm behind the back and turn your head away, because that's going to give you the most amount of stretch on that pec muscle, as well as breaking up that scar tissue through there. You'll find some different areas that are much more tender. Making sure you're staying hydrated, again, is another key part of having success with this mobility work. You got about another 5 seconds in there. And again, if you need some more time, just hit that pause button and you can catch up with us. Awesome. And that is how you use a lacrosse ball to help mobilize the pecs. Next muscle we're going to work on is the bicep. So this is a big neglected muscle, especially with a lot of shoulder pain. Most people think of the bicep just from here to here, but the long head of the bicep actually travels all the way up and attaches up on the top of the shoulder and is responsible for some of the flexion. Also, it's a big culprit in a lot of the anterior impingement issues. Again, because very rarely do we ever fully stretch our bicep out. We're always here, they're always short, they get very tender. So what we're going to do is take that lacrosse ball and up in the door channel again, because it helps lock in the movement of that lacrosse ball, you're going to put the lacrosse ball on the bicep, up against the door frame, and then just slide up and down the bicep, out to the side, across the muscle belly of it, and you're going to find some tender spots. And when you do find those tender spots, you just want to spend a little bit of time there. Now, this one can be a little tricky to get used to the positioning on to start off with. You may have to hold the ball in there, just keep it from shooting out. As you get more comfortable with it, it's going to come around a lot better. Now, something to keep in mind when you're doing lacrosse ball work, or mobility work, when you first start, it's going to hurt a lot, okay? As your tissue gets healthier, it's going to hurt less. So you don't have to spend as much time on those areas. If you get to an area you're like, man, I don't feel anything on there, you should check it periodically, a couple, 3, 4 times a week. But if you don't have the tenderness with it, you can move on to another area. And that's how you can keep this down to a nice 10-minute protocol as we're going here. And we're going to switch over to the other side. Again, on the bicep in the door channel. And then just getting that angle of holding it in, up and down. You can feel some of those tender spots. And although it seems really weird that rolling here will help with pain up in your shoulder, it is very effective, and again, one of the most neglected areas when it comes to managing shoulder pain for people. So you really want to make sure you're staying ahead of this, especially if you do any kind of Olympic lifting or pulling events, things like that, where you have the elbows bent, or if you lift like I do and you're a little bit more of a puller, you get a little bit too much bicep involved in that. So you want to get that loosened up here as well. And again, if you need a little more time, hit that pause button, catch up with us as you get caught up. And that is how you use a lacrosse ball for your bicep. So next area we're going to work on is we're going to head over to the table here, and we are going to work on our triceps. So the tricep is a long muscle on the back of the arm, so it goes from your shoulder all the way down to your elbow. And to put a full stretch on your tricep, you have to do this. Now raise your hand if you do this on a regular basis. Yeah, my hand's not up only because I'm showing you the tricep stretch. So a lot of us don't, and the tricep gets very tight and sore, and it'll limit, especially like the front rack position, but even reaching overhead because that tricep will be tight. So a really good way to do this is to take that lacrosse ball. You can put it on a little firmer surface if you have one, and what you're gonna do is just put it on the table. You're gonna put your elbow, starting at the elbow here, tricep on there, put a little pressure, and then you're just gonna flex and extend your arm over that lacrosse ball. And you're gonna feel some tender spots. Go up 4 or 5 pumps, and then you're going to move up a little bit. And you're just going to work your way all the way from the elbow all the way up to the shoulder. Now, there's some other videos out there. If you have a parallel bar, or if you have a dumbbell handle or a kettlebell handle, you can put your arm up on those. Sometimes those are a little bit easier to use, but you can travel with a lacrosse ball just about anywhere. A lot of patients actually keep them in their purse or keep them in their glove box just so they have them with them. They jokingly I think they're joking, but they tell me they travel with them all the time, which is convenient as well. So you want to make sure you're getting those loosened up. And you want to work your way up. Now, a little trick is as you get closer up to the long head of the tricep here, where it intersects with the lats and a lot of the other areas, if you get more of a sideways pressure on it and then rotate forward and bring your arm in and out, or kind of internally, externally rotate your shoulder as you do it, you're going to get a little bit more work and loosen up. Again, this is a little easier to do with a bar or a kettlebell handle, but you can see and get the point of what we're working on here. So we'll go ahead and switch over to the other side. Again, positioning wise, you're going to place it here, starting at the elbow and flexing, extending, and then just working your way up that tricep, all the way up from the elbow, all the way through the mid-belly part of it. And now different areas are going to be tender for different people. Typically we see a lot of pain lower down by the elbow and then higher up through here, not as much through the main muscle belly. And that has to do with just where the muscles and the tendons come together. That musculotendinous junction typically is the site of most of the injuries, unless there's like a specific blow to an area, like a bruise or a contusion with that. And again, at that high part, you want to lean in here and get that stretch and that forward lean. And again, the firmer the surface is, the more effective this is going to be as well. Awesome. Now, again, if you need a little bit more time on that, feel free to hit the pause button and catch up with us. But that is how you use a lacrosse ball to work on that tricep. We're going to work on our hamstrings with a lacrosse ball. So you can do this seated. Again, the hamstrings, long muscle across the back of the leg. Anytime we spend a lot of time sitting, things like that, they're going to shorten up on us. This is a huge culprit with a lot of back pain, hip pain, knee issues, is the hamstrings just being too tight. So what I'm going to do is I'm going to have a seat on the table here. I'm going to put this lacrosse ball on my hamstring like so. So you're just literally going to sit on it, like the fawns, dating myself with a reference, but that's okay. You're going to sit on it here, and then you're just going to literally just straighten and bend your leg. And you're going to feel some pressure underneath there. And similar to like we did with that tri-strap one, is we're going to do about 5-10 pumps. Then you're going to move the lacrosse ball to a different part of the hamstring. And you're going to flex and extend it. Now you can roll it from side to side, dig in through the sides with it a little bit too. Just want to feel for where you're feeling those tender areas. So make sure you keep that ball moving back and forth. If you notice a real tender spot, you kind of dig on there. You can add a little bit of pressure with the hands over the top. Set a kettlebell or a weight plate on there if you need a little extra resistance on there. Awesome. And then we're going to do that same thing on the other side. So again, you're going to take that lacrosse ball, you're going to put it underneath the hamstring, and you're just going to sit on it and then flex and extend as we go back and forth. Again, the mobility work, healthy tissue does not hurt. You should be able to touch your toes without bending your knees. So if you can't, you should start doing this. So it'll also make you a much better athlete. See, as an athletic trainer, I saw a ton of basketball players that no mobility whatsoever, slouching way over, just trying to get their ankles taped. So this is a really good way to loosen that up. And a hint out there, it'll actually help you perform better too. So if that's something you're interested in, you want to make sure you make mobility work a big part of your day. So we get that loosened up here. Awesome. Again, flexing, extending, or rolling from side to side. A combination of movements is good, as you can go with the muscle fibers, against the muscle fibers, really help break up some of that scar tissue to help your stretches be more effective. So if you need some more work, hit that pause button, catch up with us, but that is how you use a lacrosse ball on the hamstrings to help with that mobility. Last one we're going to do in our lacrosse ball series here, or second to the last one, is for the plantar fascia. So I'm just going to kick my shoe off here real quick. Now the plantar fascia is at the bottom of the foot, as everyone talks about plantar fasciitis. Now this is part of the problem with it. Also the calf mobility will play a big role in that. We'll talk about that later. But what you're going to do for this, you're going to take this ball and you're just going to roll it on the bottom of your foot. And you're going to find some of those tender areas and you're going to roll it through. Now they sell some really spiky balls and a lot of different other things. You can use those, get a little bit more stimulation through that area, but I would not use like a golf ball or anything like that. Some people try that. The golf ball is a little bit too small, a little bit too firm. You can put way too much pressure on there. And again, about 30 to 60 seconds. You'll do this on both sides. Really great way to loosen up that plantar fascia. If you get that where you have it really bad, you wake up in the morning and you know that walk to the bathroom is very painful. Have a lacrosse ball by the side of the bed, loosen it up, or try it right before you go to bed to loosen that tissue up even more so it's not as bad in the morning. So we're going to go ahead and switch over to the other side here again. Kick that shoe off. And again, rolling around the bottom of the foot. We're going to go for about that 30-second mark. Again, if you need a little bit more time, feel free to hit that pause button and catch up with us as you progress through. Again, big things with the mobility is healthy tissue does not hurt, unhealthy tissue does. So if you find a tender area, that is your body telling you that's an area that needs some of your attention. So make sure that you listen to it and get it taken care of. So we have about 5 more seconds left on that one. All right, and go ahead and relax. So again, if you need that more time, hit that pause button. Otherwise, that is how we use a lacrosse ball to work on the plantar fascia. All right, and the last exercise in our lacrosse ball series with that double lacrosse ball is going to be for your suboccipital muscles. So those are those muscles at the back of the head here. These are big culprits with a lot of headaches, things like that. So this is an exercise. If you start getting a really bad headache, can't get into your chiropractor, don't want to take a bunch of pills to just dope yourself up so you're not feeling things, you can actually use this to loosen it up and relieve it a little bit. So what we're going to do is we're going to take the double lacrosse ball, we're going to put it right underneath the base of the skull here, and we're just going to lay on it. So I'm going to lay down on the floor here. Again, the firmer the surface, the better for this. So you're going to lay down. As you're placing it, you're going to take it, and you don't want to put it on your skull, you want to put it just underneath. So I usually start from the bottom of the neck here, and just kind of roll it up until I feel it bump in the skull, and then just going to lay on it like so. And just the weight of your head there will put enough pressure in there to help loosen that up. What you may notice if you're having a bad headache, it is either going to make it better, or it might even intensify or make it a little bit worse. Either way, it lets you know that the suboccipital muscles are part of the issue with it, and if you can kind of grin and bear through it, get it loosened up for that 90 seconds, it should help loosen that up a little bit here. So again, we're going to work in there. You can add a little bit of tipping from side to side. You can add a little bit of nodding front and back to work over some of those suboccipital muscles. And again, you want to make sure you're keeping this area nice and loose. This is one of the main areas that gets overloaded, especially with a lot of phone, computers, things like that. So we're wrapping up our 30 seconds. Again, if you need some more time, just go ahead and hit that pause button and feel free to catch up. So you can go ahead and sit up there. All right, and that's how we use a double lacrosse ball to work on the suboccipital muscles. Again, just some wrap-up things for the mobility. Healthy tissue does not hurt. So when you're rolling over an area and it's painful, that's your body telling you that you need to work on that area because there's scar tissue and issues with it. Second thing, making sure you're staying hydrated. Your muscles are 70% water on average, so it is extremely important that you're drinking enough water. Half your body weight in ounces of water per day, and if you drink a lot of caffeine, you need to add more water to that. So it's really, really important to make sure that you're getting water. You can also get water from fruits and vegetables, which are really good for you. And then making sure you're consistent with your mobility and combining it with full range of motion, because all the stuff we did is fantastic. It will loosen the tissue, but you need to take it through a full range of motion in order to get the full benefit of all this together. So do your mobility first, then do your stretches. Is going to make those things much more effective. It's Dr. Bob Vaughn, your local health and wellness expert. Hopefully you like this, found it helpful, and feel free to ask me any questions that you may have. Have a great day.